Hello everybody, welcome to number 1 Doctor channel. Today we will talk about prolapse of the rectum. This may be partial or complete. Partial prolapse is confined to the mucosa, which prolapses 2 to 5 centimeters from the anal verge. Palpation of the prolapse between the finger and thumb reveals that there is no muscular wall within it. It may occur in infants who are usually otherwise perfectly healthy. Treatment of these babies requires nothing more than reassurance of the parents that the condition is self-curing. In adults, it usually accompanies prolapsing piles or sphincter incompetence, and may present with pruritus ani. Complete prolapse involves all layers of the rectal wall. It usually occurs in elderly women. Apart from the discomfort of the prolapse, there is associated incontinence owing to the stretching of the sphincter and mucus discharge from the prolapsed mucosal surface. Treatment of partial prolapse in adults comprises excision of the redundant mucosa, or a submucosal phenol and oil injection in order to produce sclerosis. In children, as already mentioned, self-cure without active treatment is the fortunate rule. Repair of a rectal prolapse may be performed either transabdominally or perineally, the former being preferred in younger patients, the latter in the more elderly. Transabdominal mesh rectopexy, in which prosthetic mesh is partly wrapped around the mobilized rectum and sutured to the presacral fascia, relies on the resultant brisk fibrous reaction to fix the rectum to the pelvic tissues. The classic perineal approach was anal encirclement with the Thiersch wire, 3, in which a wire or nylon suture is passed around the anal orifice to narrow it and keep the prolapse reduced. This was complicated by obstruction and erosion of the wire and fell from favor. Today, a less traumatic approach is performed, Delorme's procedure 4, with excision of a sleeve of mucosa and pleating of the underlying muscle to form a donut-like ring, which holds the rectum in the pelvis rather as a ring pessary may control vaginal prolapse. An alternative is the Altemeyer 5 perineal rectosigmoidectomy, in which a full-thickness resection of prolapsing rectum is performed. Thanks for watching. Please like and share our videos and subscribe to our YouTube channel number 1 Doctor. With my best wishes. Dr. 8 Famid.